Okay, so now we're going to be performing oral care on the patient. Whenever you enter the room, knock first. Hello, Mr. Johnson. It's me, Nurse Valencia. Can I see your wrist bracelet? Thank you. Confirm it's the right patient. Inspect the area. Make sure there's nothing hazardous, no spills, nothing. Okay, the doctor ordered that you need oral care, so we're gonna clean out your mouth, brush your teeth, floss, and everything like that. It's important for your health and your hygiene that we do this. It's for your own safety, for your own good, your own health. Okay, lower the side rail, get your materials. So we're gonna have a bucket with water, and then also a little empty bucket for anything that comes out of his mouth, anything that could be, and also a suction and water. Suction pump and water pump. So first, okay, Mr. Johnson, have you turn on your side. Help the patient turn on their side, and then put the empty bucket under them as well as the water bucket. And then the first thing that you're going to do is you're going to clean out the patient's mouth with the water, and then put the you can use your fingers and put a cleaning material over it, and make sure you get the gums and everything. Make sure everything's clean, and then after that, you're gonna brush the patient's teeth. Make sure you get the bottom and the top, the inside and the outside of the teeth, and make sure you use toothpaste and water. And then have them use the bucket to dispose of anything, and then also rinse it out with the water and use the suction as well. And then after that, make sure you floss using your index finger and your thumb on both hands. Make sure you floss in between on the top and the bottom row of the teeth. And then after that, once again, you're going to rinse it out on suction as well, and make sure that you didn't hurt them or anything and stuff like that. And then after that, dispose of all your things. Mr. Johnson, I put and then put the towel on top of them as well to minimize the mess you make on the patient. Okay, Mr. Johnson, leave the call light, your water, all your personal belongings near you. Please don't hesitate to use the call button if you need anything. And then now we're going to jump right into bed bathing a patient. So lay on your front again, on your back. Okay, so going straight into the bed bath and perineal care. So, hello, Mr. Johnson, Nurse Valencia. The doctor ordered a bed bath because you're on bed rest. So I'm just going to give you a bath while you're in the bed. So check the area for any spills, hazardous materials. Lower the side rail on my side. Get all my materials ready. So the first thing I'm going to do is I'm going to put a bath towel over the patient. Can you please hold this bath towel, sir? Thank you, Mr. Johnson. Let me know if you're uncomfortable at all during any of this, and we can stop. Then you're going to remove the top towel, not all the way, just down to the end of the bed. Pull it up a little bit. And then you put the bath towel so the patient stays warm, and as well as for their privacy. And then, so once you put the bath towel on, you're going to carefully take off the gown that they have on. So, Mr. Johnson, I'm going to have you take off your gown. Take off the gown. If they have any IV bags, do it very carefully, one arm at a time. And once the gown is off, get your soap ready with lukewarm water, preferably 120 degrees. Okay, and then you're going to get you're going to fold the towel in your hand, like so, and then you're going to do one. So first you're going to start with the face. You have your bucket of water right here. So for the face, you're not going to use any soap at first. So you're going to use the washcloth, wet it, and so what you're going to do is you're going to start with the eyes and go away from the eyes on both sides, away from the eyes, start under the eyes, on top of the eyes, and go away from the eyes. And then after that, you're going to do the rest of the face, continuing to go away from the eyes and more towards the ear at the finishing point. And then after that, you're going to rinse your washcloth. This one you apply the soap, and then you're going to lift the bath towel, only exposing the body part that you're going to be using. So, Mr. Johnson, can you please? I'm going to do your arm. Perfect. So then you're just going to scrub the arm with soap and water on the washcloth. Well, you're going to get it wet first, and then you're going to apply soap to the washcloth, get it, and then you're gonna use only water on the washcloth again after, and then you would, okay, you can put it under, and then you would go to the other side, do the same thing with that arm, and then you would do the chest and the neck area, and then after that you would go to the legs and the feet, and then the other leg, and then after you do that, you would have them turn. Can you please turn over on your side, sir? And then when they're on their side, that's when you do the back, and then this is also when you do the perineal care. And make sure if it's in a female, you do it from front to back, and not from back to front, from front to back, to minimize any UTIs and other infections. So make sure in a female you do it from front to back always. And then, okay, sir, so once you do all, that's the final step. Okay, sir, you can lay on your front again. So yeah, so it goes face, no soap at all, and then it goes the arms, then the chest, and the legs. And so for the arms, the chest, and the legs, and the back and the feet, that's when you do the wet washcloth, then the soap and the water, and then the water only again. Okay, Mr. Johnson. So you would help them put their gown back on, make sure they're dry and everything, and then we lift this back up after you put the gown back on. Now I'm gonna take the bath towel, Mr. Johnson. Okay. And then dispose of all your materials. Make sure everything's good. Lift up the bed rail. Okay, Mr. Johnson, the call light's right there. Your water's right here. All your belongings are right here, within arm's reach. You need anything, just let me know, please. Don't hesitate to ask me for anything. And I'll be back in about 30 minutes to check on you again. Thank you, sir.